Thank you all for coming tonight. This is our 7th dinner to recognize our physicians of the MGPO, and this is also our 20th anniversary. I'm David Torchiana. I'm the head of the PO at the present time, and I want to just go over a little bit of the logistics for tonight. First of all, I'll say, whereas in past years we've had a little bit of a State of the Union summary at the beginning of the dinner, I've decided to forego that tonight. We have a lot to cover as it is on the agenda. And also, I think that we're facing a lot of uncertainty and a lot of things going on in the external environment. It's not really necessary or appropriate to speculate about where we're headed. So I've decided to keep the evening focused on the PO, our doctors, and what's right with the world, rather than speculate about what may never come to pass. And I just want to say, I think we'll all agree, everyone in this room, that we're incredibly fortunate to be working with such great colleagues at a great institution. And I'm confident that whatever lies in our immediate future, the next 2 centuries will have lots of positives and lots of promise. So I want to start by recognizing some of the important MGPO supporters that are here tonight. I'll start with the board, and I will name all the board members that are here this evening, and then ask for a round of applause. So we'll start, of course, alphabetically with Jerry Austin, Laura Barker Morse, Chris Coley, John Deutsch, Carlos Fernandez, Art Goldstein, Jay Leffler, Kathy Minahan, Pam Reeve, Isaac Schiff, and Ron Skates. Please thank them for all that they do. We have some other luminaries tonight. We have Peter Slavin and Sam Thier, former MIT president Susan Hockfield and her husband, MGH physician Tom Byrne, are here. And I especially want to thank Ira and Jackie Stepanian for coming tonight. Their generous gift funds our physician recognition activities. So thank you to Ira and Jackie. We're going to have a little bit of focus tonight on the origin and founding of the MGPO, and we have a number of the founders who were involved in that original process here tonight, and I will announce their names later in the program. In addition, I'm very pleased that many family and friends of Dr. Brian McGovern have been able to attend tonight. We have Ann Jennings McGovern, her eldest daughter Katrina, who is now a third-year HMSer on her way to become a physician. And I would like to thank Ann and Katrina and all the friends and family for being here with us tonight. So in the past, we've opened the dinner with a video and then had the recognition awards after dinner. We're going to turn that around a little bit tonight and start with the McGovern Awards, then show a video after dinner. And the reason is because tonight we're also going to confer a trustee's medal as well. After this is all concluded, the band, the great band Legit, will be playing, and you can have another MGH Manhattan if you choose. I hope you all noticed that they relieve administrative burden, allegedly. So tonight is about the heroes of clinical medicine that go unappreciated. And these are folks like Brian, who work to take great care of patients but don't always get the recognition that they deserve. Brian was a terrific doctor and a great person to be around. He had an amazing blend of humility, intellect, dedication, and good nature with an irreverent and subversive sense of humor. And he also had a knack of connecting with other people, whether it was a worried patient, a stressed colleague, or his own family whom he cherished. he truly had a gift with people, I think almost unlike anyone I've ever seen. So after his death, untimely and tragic, we decided to create this award in his name, an award for clinical excellence to honor physicians who emulate his qualities and to try to keep us reminded at least one night a year that for all the incredible advances in medicine, the science, technology, and new procedures, that it's the way we treat our patients and each other that sets great physicians apart. We had a great round of nominations again this year. We had 102 clinicians. They're all on your dinner program, 102 nominations. I think the pipeline remains strong. The folks on the selection committee thought it was a wonderful discussion and a wonderful group of prospects. So before we go into tonight's awards, I want to recognize 9 of our 20 prior recipients who were at least intending to get here tonight, and I've seen many of them. And if you could, again, hold the applause, and we'll acknowledge them as a group. But I'd like this group to stand as I read your names. So let's start with Nestle Bazgaz, Hassan Bazari, Charlie Boucher, Dennis Burke, Elizabeth Dooling, Carlos Fernandez, John Godin, A.K. Goodman, and Mark Pasternak. Thank you all. So to do the awards the way we've set it up in the past, and it seems to work pretty well, I'll ask a colleague to come up to the podium to read excerpts from the nominating letters for each of our 3 award winners. We're going to start with Taylor Thompson, who's going to read from the letters for this year's recipient from the medical services. So thanks a lot, Taylor, for taking this one on.
Thank you, Torch. Well, I'm very pleased to have the opportunity to read from many of the nominating letters for this year's award winner. We'll start with a colleague in her department who wrote, "Her commitment to our patients is extraordinary. She'll find a way to see any patient who needs her, answer any colleague's question, and if she doesn't know the answer, she'll find it out. She's been recognized for years by the medicine service for her teaching and advice on the most complex of inpatients, and she advocates relentlessly to make sure the right things happen. She finds and extends her expertise to people who need her wherever she goes, whether it's a homeless person on the street or a colleague she runs into at Whole Foods." This physician also has multiple fans in other clinical departments. For example, one writes, "In my 16 years on the medical staff, I have had the chance to work with some of the finest doctors anywhere. She's one of the most reliable resources from my clinical practice at MGH, and I consider her to be the best of the best. She's extremely well-grounded in her discipline, pays attention to every detail, and is thoroughly patient-focused. Whether it's with patients or with the residents or students, she takes the time to do the job right. She is one of MGH's finest." Another nominator from outside her department writes, "She interacts extensively with physicians throughout MGH, often saving the day with her outstanding clinical acumen." I know this to be true. "She combines stellar medical knowledge with a deep love of teaching. She works long, difficult hours and combines her gentle brilliance with admirable roles as mother and wife. She's an outstanding candidate for the McGovern Award." Patient comments were also submitted in support, which is just a lovely thing. "Each visit," one patient writes, "with her is an enormous relief and comfort. She's such a good communicator. She stands out as both a scientist and a human being." I know that to be true also. Her chief echoed the sentiments of her colleagues. "She's one of those rare doctors whose medical knowledge is as deep as the Pacific Ocean, but whose warm and sensitive manner makes people feel like she is one of their best friends. She's a brilliant diagnostician and frequently the hero who saved the day. She was one of the first members of our faculty whom I saw step outside and seek the opinion of another faculty member. This was not due to any lack of experience on her part. It was a manifestation of her extraordinary experience. Let's finish then with a few comments from my own nomination letter. And I wrote that I've had the pleasure of working with this physician since her first days at MGH and was delighted when she agreed to also take me on as a patient. Thus, then I can comment on her incredible talents from both perspectives of patient and colleague. And I wrote that it feels like just yesterday that our MICU team was in lockdown mode on Blake 7. Our friend and go-to clinician, Brian McGovern, that kind and gentle man who lifted the spirits of an entire patient floor just by walking down the hallway. The man who, with a brief encounter as a consultant, came out of the room knowing more relevant and important personal details about our long-standing patients than we did. The master of his craft was gone. This annual award helps us remember just how special he was. This physician, this year's award winner, is also that kind of clinician and an absolute gem of a human being. She too lights up the MICU just by walking in the door. Residents and staff alike, when confronted by an enigmatic case, almost in unison say, "I'll bet she will know what it is." After going through a focused differential diagnosis in her gentle and professional way, she will give you, like Brian and Mort Schwartz and Roman DeSanctis before her, the diagnosis. Recall your own encounters with each of these marvelous individuals. Doesn't it just put a smile on your face? Such knowing consultations imparted with such delightful professional interactions are one of the primary reasons MGH is such a special place for patients and clinicians. All of this is true in her busy office. I consider myself a low-maintenance patient. I hope that's true. I see her because I have a strong family history of melanoma. While we've had a couple of scares over the years, just knowing she is in my corner has given me enormous peace of mind. I can think of no one better suited for the 2014 McGovern Award for Clinical Excellence than the 20-plus year leader of the inpatient dermatology consult service, Dr. Bonnie McCool.
So this is why we keep the notes in a notebook. Now, the next presenter needs no notes, as we all know, having heard him speak many times. And I'm really grateful for Bob Hughes to be willing to come up and present the next award.
Well, Taylor, that was going to be hard to top. And Bonnie, congratulations. We all feel the same way, that's for sure. But I also have an incredible privilege tonight to be able to speak about tonight's winner from the surgical service. And Torch, thanks for asking me for being part of the McGovern Awards tonight. So, it's usually a pretty good sign when the nominations for this award come from the nurses. This physician earned multiple such endorsements. But I'd like to read from two of the endorsements from our nursing colleagues. Quote, "This doctor is the reason I am a member of the MGH staff. As my years at MGH have piled up, it has been a privilege to work alongside him. He teaches me each time I ask him a question, even to the point of making an elaborate drawing of a particular organ system on a napkin. He instills in you the desire to become not only a better nurse, but also a better person. Patients, residents, and colleagues have nothing but respect for him, and he has a smile on his face from sun up to sundown. Another of our nurses said, and we quote again, "I met this physician 23 years ago when he was a resident, and I was 6 years into my nursing career at MGH. He was as vigilant and compassionate with his patients as a resident as he is today in his practice. He is unswerving in his clinical excellence and his dedication to his patients. Whatever the issue, and meticulous in his detail, not satisfied until every dressing, every procedure, taping of a tube, drainage bag, or anything else having to do with his patient is just as it should be in order to achieve the best result. In the operating room, he takes advantage of every teachable moment, always constructive and non-judgmental. He defined what I think of as quality care at MGH with his skill as a doctor and his skill as a surgeon and the humanity that he brings to the care of his patients. In addition to the nurses, we also have plenty of physician colleagues who have nominated this physician, and I quote from one of the nominations. "He is one of the best physicians I have ever worked with. He's not only truly outstanding as a surgeon, but also as a unique individual who senses the complex feelings of our patients. He always makes a great effort to optimize the pre-op and the post-op conditions and spends time, very often after hours, speaking to the patient and to their family members. He's even been known to drive a patient home, if that's what it takes." It's a little much, but we get the idea. I bet that just happened once. One of our other colleagues wrote, "His area of specialty demands late and unpredictable hours, careful surgical planning, and dedicated post-op follow-up. His compulsive attention to detail is famous, but his gentleness and positivity are equally impressive. Seemingly always on call for emergencies, he's consistently cheerful. He teaches residents through his own keenly developed stepwise and safe techniques in the operating room and through didactic board sessions over lasagna, come on, this is too much, that he brings himself." How many Irish guys make lasagna, really? So I should have stricken that one out. But he does do this. He does model professionalism consistently, and patients seeking his care travel from every continent, often flying directly over other medical centers, Stanford, University of Chicago, NYU, so they can get to Boston to see him. We also had a nomination from a physician who actually has come full circle with this physician from being his resident to being his patient, which is tough for all of us. I have had and I quote from this physician and patient, "I have had the privilege of knowing this physician for over 17 years in two distinctly different capacities. First as a trainee, and more recently, I've become one of his patients. I cannot think of an MGH physician more deserving of the McGovern Award for Clinical Excellence. I was fortunate to have a chance to learn from him early in my surgical training. His technical skill was obvious, and he set the perfect example, always taking time to do it the right way. It was also clear how much his patients and their families appreciated his efforts to give them the best possible care and keep them informed about their progress. He treated everyone with respect, and he had the respect of everyone that he treated. My experience as his patient has only enhanced my admiration. I now live in the Midwest and had consulted with several specialists, but my medical condition continued to worsen. I needed someone who I respected and someone I trusted, and he came immediately to mind. His care was superb, and I hate to think what the state of my health would be had I not consulted him and received his concern and expertise. I will always be grateful to him for the role he played both in my education and for now what he has done for me as a patient. He exemplifies all of the outstanding qualities that one would hope for in a physician and a surgeon: compassion, integrity, expertise, and skill. Finally, this nomination sums it up. He is the first name uttered when a urologist is needed, and he is the first to respond when called upon. His management and decision-making are always appropriate. His compassion for his patients is what drives him and what makes him a role model for those who work alongside him. He is the type of physician I am trying to become. It's with great pride and with great honor that I announce that Dr. Frank McGovern
He is not a relative. Except in spirit, I guess. Finally, for the non-medical, non-surgical services, I asked Janie Pratt to come up and give the final award. Janie, thank you.
Thanks, Torch. Thank you for giving me the chance to announce the third and final recipient of the McGovern Award. This one representing the other services, which include anesthesia, emergency medicine, pathology, pediatrics, radiation medicine, and radiology. I couldn't be more pleased to tell you about this colleague who emulates all that Brian McGovern meant to medicine. I'd like to start with these comments from several physician colleagues. Ours is an extremely busy service that maintains close ties with multiple clinical referring services and plays a critical role in both diagnosis and treatment. He is the face of the division and is extremely dedicated to his patients and to our specialty. I am sure he is the most well-known of us at MGH because of how he closely works with the other clinical services in the care of complex and sick patients. Another colleague said, he is widely recognized throughout MGH for his unwavering willingness to help with the most difficult cases. His motto is, can do, will do. His collegiality is legendary and refreshing in the face of the time-compressed, high-pressure world in which we live and practice. One of the nominations talked about his contributions to teaching. His commitment and joy of practice have drawn generations of residents into his fellowship program, which is second to none in the country. He has trained leaders who look to MGH for direction in their practices, and more importantly, for how they should practice as professionals. And what I think is a first for the McGovern Awards, 2 chiefs of service nominated this physician. Here's what his own chief said. While I did not know Dr. Brian McGovern, it is clear that he combined terrific clinical skill with a compassion and kindness rarely felt by patients from their doctors. Fortunately, some physicians fully embrace these traits and inspire the rest to treat patients as if they were the closest family members. This physician is one such individual. He has won the hearts of countless patients through the kindness and compassion he shows those who come for his care. It is clear that he connects with each patient on a very personal level and makes each one feel as if he or she is the most important person under their care. Here's what the Chief of Surgery, Keith Lillamo, had to say. I'm writing on behalf of the Department of Surgery to second this nomination, to throw the support of the entire department behind the physician. I'm one of them. I totally agree. He and the team he leads is essential, providing the highest level of care to our patients. His mentality is clear: service first, and that service brings with it an extraordinarily high level of expertise and care. Here's what the parents of one patient said. He went above and beyond his duties as a doctor to get to know us and help us believe that our son was going to get better, even if it was a slow and scary process. He also helped our son to understand what was happening every step of the way. He and his team took the time to get to know him, and the friendship they created allowed our son to trust in all that was happening. He is a special doctor, and Mass General is lucky to have him. Finally, I think this colleague summed it up best. In a specialty that has become more and more removed from direct patient care, he has managed to maintain an integral position in the treatment and management of many patients with complex medical conditions. He leads by example. As images and reports have become digital, some radiologists can accomplish their work by sitting in a dark room and sending out email alerts. Not this physician. All residents and fellows training in his department learn to pick up the phone and call the doctor, to talk about the case, and to never utter the words clinical correlation advised. He has created a radiology division where patient care comes first. Whether he is placing percutaneous nephrostomy catheters in a comfortable position for a patient who loves to play golf, or mentoring his colleagues, or teaching his residents, his central mission is clear. Think about the patient and do what you can to help. It is my pleasure to announce that Dr. Peter Mueller is the 2014 recipient of the McGovern Award for Clinical Excellence.
Thank you. I've been approached later on in the evening at these dinners more than once by sincere people who have said to me, is this really a good idea to dangle these examples which are so exalted and so wonderful and almost so perfect in front of a bunch of really hardworking, gifted, intense people who realize that they'll never be perfect themselves? First thing I'd say is that I have the fortune of knowing all three of these recipients tonight and all three of the presenters, and believe me, none of them are perfect, but and that may be a sufficient answer. But I guess the point that I'd make, the reason why I think this is a good idea and still a good idea, isn't it nice to think of what the qualities are that we all strive for, even if we can't get there every day or even many of the days that we show up to work. So I'd like to congratulate Bonnie McCool, Frank McGovern, and Peter Mueller. I think you personify Brian's enduring spirit, so thank you all. So we're going to serve dinner now. After the meal, we will show the anniversary video, a video the great Steve Rourke put together on the founding of the PO. We'll show that over dessert because we can just turn up the volume and the knives and forks don't matter while we play the video. During dinner, we'll have names of all the nominees and some text from the nominations on the screen. And you'll also see some words and images that reference the 20th anniversary. So please enjoy your dinner. I'll see you a little later on.